superficial side, and then you're going to have a deep side. And so you always have to look at yourself and orient yourself, make sure you know which one is which. We're going to start on the superficial chest, which is going to be your pectoralis major. Okay, on the deep side, this smaller one that comes up is the pectoralis minor. So pectoralis minor is on the deep side, underneath the pectoralis major. And then where you can see the light pink in between the ribs, these are your intercostals for in between ribs. They're these light pink. But now you'll notice from your list that you have internal and external. And so if you look closely at these muscle fibers or the line markings on the muscles, you'll see they kind of make a V. And then there's like a line in between the two, okay, where you can kind of see a step down. The midline one, or the closest to the midline ones, are internal intercostals, and then these outer ones are external intercostals. Diaphragm you can cross off. I don't usually put it on muscles there. Alright, and now we're down to the belly area or abdomen area. Again, superficial side and deep side. Okay? On the superficial side, you'll notice that everything looks kind of a light pink. That's because there's some connective tissue that goes along the surface that's making it not look the bright red. It's a white color, so it's making it look instead this pinkish color. That's your fascia. So for rectus fascial sheath, you're going to put it on the superficial, like the midline of the superficial side. Rectus fascial sheath. It looks like number 19 maybe on your thing. Okay, on the deep side, this is now the full red muscle, so this is the rectus abdominis. The line going down vertically in the mid, straight on the midline, is going to be the linea alba. So if I want linea alba, I'm going to put it on this white line going straight down the middle of the belly, the vertical line. And if I want tendinous intersections, I'm going to put it on the horizontal white lines. So tendinous intersections on horizontal, linea alba on the vertical. Alright, and then we just have left our oblique muscles, which are going to be on the sides. And this is a little bit tricky. You have 3 layers of obliques. It goes external, internal, transverse. But on the models, you know, they don't just pull off. So instead, you have to know which side is which. So the superficial one is the external abdominal oblique. External is going to be the superficial side. Then the internal abdominal oblique is going to be on the deep side. And the transverse abdominis is on the back. And you can also always look at the side, and you'll see that one side, the superficial side, has 3 layers of muscle, and the other one only has 2. And so you can use that to kind of double check yourself. I don't like this model, but sometimes we have to use it, so I do easy ones on here, like pectoralis major, rectus fascial sheath, rectus abdominis, tendinous intersections. That's about it.